Welcome to Wellness Radio with Dr. Jeanette-Gallagher as your host. Her show discusses topics of health, wellness, and spirituality, and is about discovering your place in this great universe, from your cells to the cosmos. Along with her guest, in casual conversation, she strives to ask the difficult questions that may be holding you back from a vibrant life, and shares new ideas that may inspire you to make a change in your life that you only can see in your dreams. And now, here is Dr. Jeanette-Gallagher.
Good evening, everyone, and welcome to Wellness Radio. This is Dr. Jeanette-Gallagher, and it's a pleasure to have you with us here this evening. Tonight, we are going to be talking about how to bring our body, our mind, our spirit, and soul back into focus. How to bring things back together. How to see how everything in our essence of our life, in this human organism we were given, is truly about a web. Everything is interconnected. One thing may depend on another, another may influence another, and another thing may shut down another system or organ, or a thought or a feeling. What is that all about? Today we're going to be talking about our brain and our mind, and how the influences within our physical body, our mental body, and our spiritual body are also interconnected. When one little thing is out of sorts, perhaps it kind of drags things along, and eventually over time we say, I don't know how I got that sick. I don't know where that disease came from. Oh no, that can't be right. You must be wrong. But in essence, if we look back at our life in retrospect, we could say, I can pick the day that I started feeling funny, had a thought, maybe I started feeling this little thing turning inside of me, or maybe my thoughts just weren't on track, and I know when all this started. My guest today is Dr. Susan-Trachman. She is a psychiatrist for over 30 years, and what she's really going to be talking about today is how can we notice a brain and a mind function, see what's really going on, how it interconnects with our physical essence, and see that it is all part of the one magic, and that's what keeps us in this existence today. Dr. Susan, thank you so much for joining us today. It's a pleasure to have you with us.
Well, thank you, Dr. Jeanette. The pleasure is mine.
I'm so glad to have you. We talked so much on this show over the decade about how in the late 90s, doctors started to specialize, it was like, oh, I don't want to be a primary care person. I need to be this, I need to take care of the heart or the blood vessels in your toe or the blood vessels in your eye. And what happened was that we got so secularized and specialized that we couldn't even see the bigger picture. Do you think?
Well, I think that the idea that we become specialized, you're absolutely correct. And I think, that has its pros and cons, meaning I think we do like to have specialists who have expertise in certain areas so that if we do, for example, happen to have a disorder that would lend itself to seeing an expert in one particular area, we would like to have someone who spent their career studying that area. I don't think I want to have an allergist operating on my brain if I have a brain tumor, for example, even though we've all gone to medical school. On the other hand, and what I would like to talk with you about today, and I think you've done a wonderful introduction, is sometimes what happens is patients present to a physician's office with what I call medically unexplained symptoms, which is really a misnomer because they are not medically unexplained. However, the presentation is out of proportion to what one would find on objective data, such as physical exam, laboratory studies, or even imaging. And it's not as if these folks are making up their symptoms or their complaints. They really do experience them. But unless you consider the entire body and the brain, which of course is connected to the body, you may not get to the bottom of the answer of what's going on. And with respect to what you introduced earlier, you go to a specialist for one thing, and they're going to try to fix that one thing because most of us go to medical school because we want to help people, and when someone walks into our office, we're going to tend to focus on what we know best. So a neurologist is going to focus on certain movement they're going to do a neurological exam and focus on particular disorders of the neurological system. You go to an internist, they might specialize and look at something else. If you go to a rheumatologist, they're going to be doing an autoimmune battery to look for that. And not that they're trying to not help this person who's presenting with a medically unexplained symptom. They're trying to focus on the area that they know best so that they can be of service.
Right.
So how do I fit in? I like to say I'm the specialist that other specialists refer to when they don't know what's going on. Mm-hmm. And it's not that I'm any smarter than they are. It's just that my area of psychiatry is called psychosomatic medicine, which are real physical disorders, as opposed to folks who make their symptoms up, which are called hypochondriasis. These are real physical illnesses that are made better or worse by one's emotional state.
So you know what I find also, too, Dr. Susan, is that a lot of times people are trying to, as we would say, they look on the internet and they're trying to vocalize what they're feeling inside. They're trying to tell you, the doctor or, the therapist or whatever, they're trying to say, this is what I'm feeling, but they don't sometimes have the correct words that the doctor can put in the EHR and click, click, click and come up with a diagnosis. Yeah. That's why they end up with people with you, like you, that might be able to be, I almost call you as an intermediary, a bridge person, who's going to say, I'm hearing what's coming from their brain, their thoughts, their feelings. I'm putting it into, I'm translating it, I'm kind of morphing it, I'm putting it into this focus, and now we have something to work forward with. And I think that's what a lot of people really need is someone, they even come to myself for the same reason. I need to be heard. This is what I'm trying to say and how I'm feeling. And can you translate it so we can get somewhere? Isn't that really what they're looking for?
I think you're on point. But I think also, Dr. Jeanette, the advantage that you and I have is that we're trained to listen. We'd like to think all physicians are trained to listen, but we're trained to listen, and I have the good fortune of being able to spend more time with patients, so I never do less than an hour evaluation. Most specialists will see 3 people in that period of time. I don't know how you do your practice, but I think we have the luxury. Yeah, so we have the luxury of time. And, I have been trained in what's called a biopsychosocial model, which is we look at the biology, we look at the psychology, and we look at the sociology, meaning their environment. And so when you put that all together, that's kind of, and the terms have varied over time, whether they're, the mind-body connection, psychosomatic medicine, biopsychosocial model, they've changed over time. But I think, we're on the same page in terms of what we're looking at.
Right, because if you look at it, I'm over 65 now, but I come from a lineage of horrible abuse and violence and everything in many of my decades, and as all did my ancestors. But however, if you take a patient and you're looking and you're saying, well, this is what I want you to do, and you'll take this drug and it'll do this, and then they go home and it's sort of like, the what still keeps hitting the fan. You can push all the drugs you want. You can push all the therapy you want. You're getting zero, which is what I did. I started doing home visits. I said, I'm going to come to you, and I want to see what your terrain looks like. And that's what you do, too, is in their thoughts and in your time and in your story with them. You want to hear, what is your terrain about? What is existing within your... And not just within your body, what's existing in your auric field. Everything from there on in, we're going to work on, right?
No doubt. And, there is very good research that supports exactly what you're saying. And, even major medical complications such as cardiovascular disease. I mean, there's so many factors impacting it, but one of them is certainly a person's environment. What if they're in a low socioeconomic class, for example? What's their housing situation like? Do they have air conditioning in the middle of summer? What's their diet like, which we now know is so important in so many medical conditions and psychiatric conditions. But if you're impoverished, obviously you're not going to be able to get necessarily the best fruits and vegetables and low calorie, low fat foods. So what's the work situation like, which is certainly part of their environment. There's tremendous amount of work stress, as you know, and particularly, with the recent pandemic, people being in work, people being out of work, people being in hybrid work, people not being able to go to work because they've gotten sick.
Right.
Tremendous stress as a result of that. And again, there's very good documented research to support the fact that even work stress very much impacts people's physical and mental health.
Yes. It's so interesting, too. I live in the land of hurricanes. Last year we had Hurricane Ida over our head. And just recently, I think it was like in the middle of June, I'd gone to the doctors and they said, your blood pressure's through the roof. Blah, 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 let's take a drug. I said, no. This is hurricane season. Leave me alone. Are you not listening? I'll be like this till October. I'll see you in November. How's that? Because I had known it's my own internal barometer, so to speak. Do you think that truly what your work also does is tries to access what is your internal barometer that is turning your organs, your thoughts, your mind, your body up, down, or shutting it off?
Very much. And I'll give you an example. I have patients in my practice, and I call them the Ferraris, these really, fancy sports cars. Not that I know a lot about fancy sports cars, but I know what they are. So my patients who are Ferraris are very finely tuned to every little nuance in their body, just like somebody who drives a Ferrari, I believe, knows every little nuance in the sound of the engine. So these folks in my practice who are the Ferraris, I know they're going to get side effects from anything I prescribe, even if there are no side effects to get. So I predict them for them. And I said, you are super sensitive to what goes on in your body. You're highly attuned, which is good because you're going to know when something's wrong. On the other hand, sometimes you're going to assume that something's a lot worse than it really is. Versus somebody who's like a clunker, who's like, they could have one foot in the grave and they're not going to pay attention to their symptoms because it's like, oh, well, I always feel that way, so what difference does it make?
Yes.
So I think very much so. So one's internal interpretation, for example, of their symptoms is going to have an impact on how much valence or how much importance they might put on any particular symptom that they have. So I have a headache. Ooh, I have a brain tumor versus I have a headache. Well, I have allergies. That's probably what it is.
Yeah. And I think also, too, you can look at the pros and cons of everywhere along the paradigm. Because, if you ignore some of the symptoms, you say, oh, I've had them forever. Well, maybe you have, and now they're just getting louder. It's just, oh, my hearing is going bad. I'm not paying attention to them. You know what I mean?
Exactly. Yes, but, yes, I do. Yep.
Yeah, and it's like your body is speaking to you. What is it trying to say? Well, it's been banging on the wall, and now it's got a fist through the wall. But you're just not hearing it. But in essence, sometimes, too, I myself am a medium. I pick up everything. I can go to the grocery store and I come home and I'm like, okay, someone must have passed by somebody that was just died or something. And it's sort of like, oh, now I need to go take a shower because I don't feel good. So the idea is that are we picking up the nuances of the energy in the world around us too? Because we see things on TV, we feel things from other people. That's the Ferrari people.
Yeah.
But also, too, we just don't know how to verbalize that. To be able to say, I need a different box of tools. I need to know when I go to the store, I need to be stronger. I need to, if anybody's like looking sad, just say, oh, it's going to be okay and be attuned to that. Or if I go to a dinner and I don't like the people that are there, I need to say, you know what? I think I'm going to choose to take my food and go home instead of sitting there trying to eating it, getting a gut issue, and then saying, well, but I have to be right. All of these are topics that people talk about all the time, don't you think?
Yeah, I do. And just to sort of focus in on one of, I think, the really important things you said is people not having the right words to express what's going on with them. There is a term called alexithymia where folks really do not understand how they feel. I have just sort of written a book, and one of the chapters in the book is on alexithymia, and it's like and my quote is, there are no words, which is exactly what it means. There are no words. Right. So if you have no words to explain what you're feeling, you don't have a clue of the fact that perhaps you're anxious, and that's why your blood pressure is going up, or
Right.
you're feeling really depressed, which causes a whole cascade of inflammation, and that's why your chances of recovering from cardiovascular surgery are not as good as someone who's not depressed. So it's very much connected. Yeah.
Yeah, I had spoken with a patient that had a quadruple bypass and valve done just a few weeks ago. And they had spoken to me afterwards, and they said, I've been having this, terrible back problem, and in my side, and blah-da-da-da-da, and it's been there for weeks, and blah, blah, blah. And then all of a sudden, I've been telling them, and they haven't been doing anything about it. But they said one day they got a new doctor, and the doctor was Chinese, and the doctor was oriented in the other medicine,
Yeah.
And the doctor says, okay, so what about your bowels? And the patient said, I haven't gone, I probably, 4 weeks now?
Oh, my God.
And they said, well, we're going to fix that today. But you see, they didn't know how to verbalize it. All they knew was what they had these pains everywhere. And those pains could be ended up as, is that your heart problem? And, we're going to fix that. Don't worry about it. When in essence, that was not even what they were trying to say, right?
Not at all. And like I said earlier, if you go to a heart doctor and they've just operated on you and you come in with symptoms that make no sense based on what you've just done, so it's like, well, it's not your heart, so don't worry. Well, not to say, okay, it's not your heart, but maybe it's something else. Yeah. And that's how things get missed, unfortunately.
And we're seeing this a lot right now with the patients that are on Medicare. Boy, once you hit that 65 and you get Medicare, the doctors, hey, I've got 10 minutes and we're in and out of here. And, it's okay that you've got a cyst on your kidney, no big deal. It'll go away. You can go home and it'll be okay. But yet the patient ends up suffering with that for months on end. And then if you look around and you look at it and you say, well, why do you have this in the first place? Well, the kidney is about fear and about change. So you're saying, what are you afraid of? And then you go down a different road. And that's where you would take the patient, yes?
Well, I would certainly evaluate the patient, yes. The problem, I think, what you said about Medicare is there's not enough doctors who will accept Medicare because Medicare is so bad about paying them. And I think that, not to get off topic because that's not what we're here to talk about, but in terms of, reimbursement from Medicare, that's a different issue. But, I think if we want to have more doctors that are going to be seeing Medicare patients as our population gets older and older, we're going to need to do something about increasing their reimbursement rates. But, yes, I agree with you. I think that many things get overlooked. I think particularly in an older population where they may not be able to or may not be expressing things the same way that, for example, a younger patient would, or some physicians unfortunately assume that a lot of symptoms older folks come in with are natural based on getting older. That's a real problem because a lot of those things are not the result of just getting older. They're the result of something really being wrong. Especially
heart disease, and we talk about depression. I mean, boy, the first time you say that something's wrong, and if you go back and you report it 2 or 3 times and you still aren't getting help, they're going to say, you must be depressed, and you ended up getting these drugs. And I think sometimes patients are very unsure what drugs are about. And I've even heard patients say to me, I'm going to the doctor, you're not my doctor, I'm going to go to my doctor, and I'm going to do what he tells me to do. And I'm going, have at it. Go ahead. Let me know. I'll see you in 10 years, But the idea, I think, is that sometimes the not knowing or not trusting yourself to make a conscious decision, but also to, let's talk about responsibility for your own health. A diabetic who eats an entire family-size TV dinner, every single night of the week. Really? Or, well, I'm going to have Coke, but I'm really thirsty. I grew up on it. I wasn't dead then. I'm going to do it now. And the blood sugars are in the 500. So let's talk about responsibility. In other words, do you squawk to the doctor and just it's almost as if you're spewing at them, and then to get it out of you, but then you don't do what they tell you to do, or they don't do what they suggest you do, or you feel like you are not going to do what they say like in your diet or exercise or whatever. Don't you think that's a really big web that I just explained, and you're going, how do we make sense out of this?
Well, I think part of it, Dr. Jeanette, is the way in which physicians talk to their patients. Meaning, I think that for a long time there was this misnomer that, doctors are the absolute authority, that, we know everything. And if we tell you to do it, it must be right, so I better do it. And unfortunately, I think some doctors have bought into that too and think that they're a little bit holier than thou. Right. So part of it is, some of the times it's cultural. I mean, I live and I work outside of Washington, D.C., so I have a very international population in my practice. And I've had to learn, and I've done my best to learn about, different people's cultures and what's normal within that culture. Because if you try to dictate to someone what they should be doing, and it's not part of what is done within that culture, you might as well take your head and bang it against the wall. So, you have to be willing to be flexible and make recommendations and then follow up with, now, this may not be something you necessarily want to follow through with completely, but what if we did this? So it's not like when I'll say to somebody who I know they're drinking way too much every night, and it doesn't matter what I'm going to do for them, their depression's never going to get better. So I'll say, I could say to you, stop drinking, but that probably wouldn't happen. So what if we do this? What if we just suggest you try cutting it in half? Right. That's what I mean about being, you got to be reasonable. If you send out dictates, so to speak, to patients, a lot of them are just not going to buy it, and that's why patient compliance is not particularly good in some areas, and that's why we have an epidemic of obesity and heart disease, and I think that we have to learn how to speak the language, so to speak, of our patients. So you have to interpret it within what makes sense for their life, where they are in their life. So you're not going to say the same thing to a 70-year-old as you're going to say to a 25-year-old because it's just not the same. Yeah.
Oh, that is so true. I had one patient, and she was very close to the end of her life, pretty much within 30 days. And she said she wanted some Krispy Kreme donuts and Creole tomatoes, and I brought them to her. And the doctor got so annoyed, and I said, what is your deal?
Right.
You're not going to have this patient next month. Don't worry about it. It won't affect your numbers, and I just continued along the path. It's sort of, sometimes we tend to restrict and we put the quantifications and qualifications of a younger patient on the older patient, and we're saying, should a patient at the age of maybe 82 or 85 be following this diet because this is going to keep their heart healthy? It's sort of like, I think we're past that point. You know what I'm saying? So can we keep them in a mental status, when we always talk about food and mood, can we keep them in a mental status where they feel comforted? Can we offer them pierogies? Can we offer them kielbasa if they're Polish and, and all? Can we bring in some Irish foods? How about some tacos every single day? And maybe they feel, and in their mood, it would feel better versus worrying so much. So I think that sometimes we have to take a fine balance. Which way are we going to tip the scales and say, you know what, have peace with it and be okay with it, yes?
Well, again, I think that sort of pretty much reinforces, what I just said, is that you've got to take people where they are. And you can know medically, I can know what would be in someone's best interest. Okay. However, I'm not going to be in their house and supervise it. I'm not going to play warden to them and say, you must do this. I will give them my best recommendation based upon my education and my experience. And then I'll say, but maybe this isn't going to work for you right now. So what if again, there's always the second part, but what if we try this? Yeah. And usually if you are willing to negotiate, things go much better. I mean, my patient compliance is quite good. So I think it's because I don't come across necessarily as a dictator and say, this is it, this is the only choice you have, this is the only thing you can do. If you don't do this, forget it. No, I can't help you. That's just not the way I approach a situation.
Right. What about the idea, let's talk about this in closing, is when diseases affect the mind. Let's say Lyme, HIV, COVID, you know, a lot of these cancer, they all affect your thoughts, the way in which your brain works, and you're going, well, holy crap, you know, now what? How do you function out of that?
Again, that's right in my wheelhouse. And, you know, I'm very familiar with the disorders that you've described. I mean, Lyme, cancer, COVID. And we know that all of these disorders and many more will affect the brain. HIV, when I was in school, I mean, we knew that this was going to be a neurotoxic virus. So we would often see patients with changes in their mental status even before their T cells started to drop. And, you know, with Lyme disease, you know, the famous case that I've written about is Amy Tan, the author, who was infected with Lyme at a wedding, and her doctors in San Francisco said, no, it couldn't be Lyme, you live in California. And she's like, well, yeah, but I went to a wedding in upstate New York, and it was in the woods. And no one really gave it a lot of credibility until, you know, years later, she started having seizures and hallucinating that her dog was talking to her. You know, and by then she basically had, you know, neurological Lyme. And fortunately, some of that was able to be reversed, but some of the other aspects of the disorder that were just present for too long could not. So she'll always have seizures. You know, she'll always have arthritis because it was just not recognized. But no, you're absolutely right that many of the disorders that we talk about have impacts on the brain and vice versa. You know, what's going on in your brain is very much going to affect the rest of your body. If you're depressed, your outcome from cardiovascular disease is not nearly as good as someone who's not depressed. In fact, the American Heart Association considers depression to be a risk factor for cardiovascular disease, an independent one, just like smoking and being overweight.
Right. And if you look back, the exact words we're even talking about, depression is a shutdown. It's a hold the cap on. It's a lower vital energy, which in turn doesn't provide the energy to the heart because is there a blockage? Is there something that isn't functioning correctly? Or is there something that just doesn't have the potential to continue life? That's how you look at the systems and how they interchange, interweave, and how they influence each other versus saying, well, that's over here, go to that doctor, and I'll do this over here. Do you think?
Yeah, and again, just to your point of, you know, if someone is depressed, I mean, like you said, they're going to be lethargic. They're not going to get up and exercise. They're probably not going to feed themselves appropriately. Sometimes when people are depressed, they self-medicate with alcohol, which makes things worse for your heart. So very much so. And, you know, sometimes I sort of, you know, jokingly say to my patients, you know, well, if I cut your head off, could you live? And they're like, they look at me like I'm crazy. And I'm like, of course, I'm joking. But this idea that there's a sort of distinct difference between your brain and your body, like they operate independently, makes no sense at all, right? And, you know, of course they're interdependent. So what's going on upstairs is going to affect what's going on downstairs. And vice versa. It's like, you know, the show Downton Abbey, that's the upstairs people and the downstairs people. I mean, you know, the upstairs people couldn't function without the servants in the downstairs, and the people in the downstairs, the servants couldn't operate if they didn't get paid by the people upstairs. So, yeah, it's a very much interchangeable situation.
Yes, absolutely. And I think also, too, that when people say, but I have these thoughts and I'm not going to let them loose, and I think this is a very important thing to close out on. People have thoughts about what's going on in their body. They don't want to tell anyone because they don't want to know that they're going to die or that they're going to be really sick or they might not have anyone to care for them. Or people don't want to share their feelings inside with their doctor because they say, well, they might put me away. They might put me in a place and I will lose control. I think those are two of the very biggest things that influence our health of our body and mind and soul in all realms, don't you think?
Well, it certainly impacts it, yes. But as I said, if I tell my patients, look, you're here for a reason. You're obviously here because you're spending your time and your money to see me. but the more you can tell me, the better I can help you. So the truth is, you don't have to be afraid to tell me anything, because I'm not going to do anything without telling you, and I haven't had to hospitalize somebody involuntarily in probably 20 years.
Yeah. I think the sense of safety, security, and survival are so much on everybody's minds these days, I mean, we saw, in the last few years, people went into the hospital and didn't come out. So what happens now? People just don't go to the hospital and they die at home. So the idea is what are we afraid of in our thoughts and our mind? How are we going to nourish and care for our bodies? And how do we see that we need a team behind us? That's really what we talked about today, don't you think?
Yes, we did.
Yeah, it's really great to have you, Dr. Susan, because I think the idea sometimes people will say, oh, well, I'm not going to do that. I'm not going to do that. And I'm going, but you are kind of, in essence, you're talking to me. How about we just open up a little bit more so it's not so scary? Do you think perhaps maybe we could encourage or inspire others to say, something's not working, just seek out a different kind of doctor versus the same kind, right?
Oh, yes. I have often suggested when I hear what's going on with a patient and with one of their physicians, if I think it's kind of not exactly what it should be, I generally say to them, there's nothing wrong with getting a second opinion or even a third one. You are not tied to this individual. You're paying basically, we work for you. You're paying our salary. So, you don't work for us. We work for you. And if you're not happy with what you're hearing, you are more than welcome, and in fact, you should seek out a different opinion.
Absolutely. Dr. Susan, it was a pleasure to have you. Can you share with the listeners can you share with the listeners how to find out more information about you and your work?
Thank you very much, Dr. Jeanette. So I actually have a blog on Psychology Today right now. It's called It's Not Just in Your Head, which is kind of what Dr. Jeanette and I have been talking about. It's not just in your head, it's in your entire body. So it's on Psychology Today blog, Susan B. Trachman, MD. It's Not Just in Your Head. And hopefully within the next year, a book by that title will come out so I can more fully expand upon some of the things that Dr. Jeanette and I talked about today.
Very awesome. Well, Dr. Susan, it was such a pleasure to have you with us here, because I think sometimes people will say, well, I don't want to be crazy. And, being over 65, my grandfather used to work for what they used to call it the nut house, the psychiatric hospital. He worked there in the 50s. And, a lot of people said, I'm not going to say anything because I don't want to end up there.
Right,
so,
right.
I think we're trying to say, can I help you and inspire you to walk a different path? That's what our real focus is these days, yes?
Yes, ma'am.
Absolutely. Well, Dr. Trachman, thank you so much for joining us today. It's been a pleasure to have you with us.
Thank you so much, Dr. Jeanette. I very much enjoyed it. You take care.
Thank you. If you'd like to find out more information about Dr. Susan Trachman, again, she writes a blog on Psychology Today. Please do check it out. The link is on the bottom of today's show page, and go directly to there to read some of her blogs. And it really is about being able to find someone that can walk the path with you, that can help guide you, give you some new tools, and be able to say, you know what, it's okay. We'll be here to catch you if you fall, if you falter, or if you need help pushing your way through that door. Because truly, that is what everyone is here for. All you have to do is just ask. If you'd like more information about my work and how I help guide you along your path, please do check out the link to my website, dr-jeanette-gallagher.com, on the bottom of today's show page. And it truly is that we are here for you. There are many different types of doctors, of physicians, of those who guide and support you. And we are all in it to be able to say, you know what, it's going to be okay. Thank you so much for joining us today. This is Dr. Jeanette-Gallagher. Until tomorrow, have a great day.
Today we discussed many life-changing concepts. Who do you turn to, and how do you know what is best when faced with a health crisis? Dr. Jeanette is a patient advocate. She listens to the patient, the doctors, and the family, clarifies the health issues and concerns, then helps the patient make the best choices going forward. If you would like help implementing change into your life and health, we can talk and see where you are stuck and how to improve the quality of your life. Check the link on the bottom of today's show page or visit dr-jeanette-gallagher.com to schedule a phone appointment today.